Introduction. Welcome to today's lecture on the topic of fistula in agno. Fistula in agno is a complex condition characterized by an abnormal connection, or tract, between the anal canal and the surrounding skin. It is a challenging condition to manage due to its intricate anatomy and potential for recurrence. In this comprehensive lecture, we will delve into various aspects of fistula in agno, including its epidemiology, evaluation and management approaches, as well as emerging techniques and future directions in treatment. Anal fistulas are not uncommon, affecting a significant portion of the population. The incidence and prevalence of fistula in agno may vary based on geographic location, ethnicity, and other demographic factors. Epidemiological studies have revealed that certain risk factors, such as Crohn's disease, inflammatory bowel disease, and previous perianal abscesses, are associated with an increased likelihood of developing anal fistulas. Understanding the epidemiology of fistula in agno is crucial in identifying high-risk individuals and implementing appropriate preventive measures. In diagnosing and treating complex anal fistulas, a multidisciplinary approach involving various specialists is necessary. Accurate evaluation, including clinical examination and imaging techniques, is crucial. Classification systems and surgical options, including drainage setons and fistulotomy, will be covered extensively. In this video, we will discuss the essential role of setons in managing anal fistulas. Setons are thread-like materials that aid in drainage and healing of the fistula tract. Types of setons include cutting, loose, and draining setons, each with different effects on healing and recurrence rates. Factors such as fistula complexity, abscesses, and patient characteristics guide the choice of seton type. Our discussion will cover various seton techniques, indications, advantages, and possible complications. Inflammatory bowel disease, IBD, particularly Crohn's disease, is frequently associated with the development of complex anal fistulas. Conventional treatment strategies may not be effective in these cases, necessitating the exploration of alternative options. Biologic agents, such as anti-tumor necrosis factor, TNF, agents, have shown promising results in the treatment of fistulas associated with IBD. This topic will discuss the mechanism of action of these medications, their efficacy, potential adverse effects, and their place in the overall management of anal fistulas. Endorectal ultrasound, ERUS, has emerged as a valuable tool in the assessment of anal fistulas. It provides detailed information regarding the course, depth, and relation of the fistula tract to the sphincter complex. ERUS aids in identifying internal openings, associated abscesses, and sphincter involvement. This session will delve into the technique of performing ERUS, its interpretation, limitations, and its role in guiding treatment decisions for anal fistulas. Negative pressure wound therapy, also known as vacuum-assisted closure, VAC, has gained recognition as an adjunctive treatment modality for promoting the healing of complex anal fistulas. This technique involves the application of controlled negative pressure to the wound, resulting in improved blood flow, removal of excess exudate, and stimulation of tissue regeneration. The session will explore the principles of VAC, its indications, contraindications, and outcomes in the management of anal fistulas. In this section, we will compare two surgical techniques, transanal advancement flap, TAF, and mucosal advancement flap, MAF, for repairing anal fistulas. We will discuss their success rates, potential complications, and factors that help determine which approach to use. Fibrin glue injection has emerged as a less invasive alternative to conventional surgical treatments for anal fistulas. This technique involves the injection of a biological adhesive composed of fibrinogen and thrombin into the fistula tract, promoting closure. Fibrin glue offers the advantage of shorter operative times, reduced morbidity, and potential preservation of sphincter function. This session will delve into the mechanism of action, indications, limitations, and outcomes associated with fibrin glue injection in the management of anal fistulas. The management of recurrent anal fistulas is challenging. This video will discuss strategies for addressing recurrence, including surgical options like repeat fistulotomy and the lift procedure, as well as optimizing medical therapy and investigating underlying causes. MRI and CT scans are important tools in assessing complicated anal fistulas, providing detailed anatomical information for preoperative planning. They can identify abscesses, sphincter involvement, extensions, and associated bowel disorders. This session will cover protocol considerations, interpreting findings, and their impact on treatment decisions. Regenerative medicine, particularly stem cell therapy, holds promise in promoting fistula healing and tissue regeneration. Stem cells possess the ability to differentiate into multiple cell types, aiding in the restoration of damaged tissues. Various approaches, including local injection of stem cells, tissue-engineered grafts, and bioactive scaffolds, have shown encouraging results in preclinical and clinical studies. This session will explore the mechanism of action, techniques for stem cell delivery, ongoing research, and potential challenges associated with stem cell therapy in the management of anal fistulas. The ligation of intersphincteric fistula tract, LIFT, procedure has gained popularity as a minimally invasive approach for treating anal fistulas. It involves the identification and ligation of the intersphincteric tract, thereby interrupting the fistula's communication with the anal canal. This session will introduce the lift procedure, detailing its mechanism of action, surgical technique, patient selection criteria, and outcomes. By understanding this innovative surgical option, healthcare professionals can broaden their armamentarium for fistula treatment and enhance patient care. To summarize, managing anal fistula requires a thorough understanding of its causes, evaluation, and treatment options. This lecture covered various topics, including diagnosis, surgery, emerging treatments, and new approaches, to help healthcare professionals improve patient outcomes.